Hey there. I'm excited to announce this to you today. This is what you've been waiting for in your spiritual quest. This is something I've wanted to do for a long time, and I'm finally ready to announce it that it's ready to go. It's the Grief to Growth Community Circle. Now, this is a sanctuary where like-minded souls are united in their journey through grief and towards personal transformation. It's more than just a place. It's a beginning. It's a commitment to growth and understanding. Here you're finding not just a community, but you're entering a circle of trust and depth. You're going to engage with interactive coursework. You'll dive into exclusive podcast episodes and partake in discussions that illuminate the path from mourning to empowerment. This is a realm where every question is honored and every individual's journey is validated. To be part of this exclusive circle, visit us at grieftogrowth.com/community or look for the chat icon at the bottom of every page on the main website. Remember that entry is a privilege because I want to ensure that every member is as dedicated and genuine as you are. You must apply to join, but the journey within is worth every step. So go ahead and join us today. Check it out, grieftogrowth.com/community, and I look forward to seeing you there.
Hi there. Welcome to Grief to Growth Podcast. Your host is Brian Smith, spiritual seeker, best-selling author, grief survivor, and life coach. Brian believes that the worst tragedies of life provide the greatest opportunity for growth. Brian says he was planted, not buried, and he is here to help you grow where you've been planted by the difficulties in life. In each episode, Brian and his guests will share what has helped them to survive and thrive. It is his sincere hope this episode helps you today.
Hey, everybody, this is Brian Smith back with another episode of Grief to Growth. And today I've got with me again, Dr. Rebecca Valla making a return visit. She and I have talked several times and we have a lot to talk about. So today we're going to be covering another topic we didn't talk about so much the last time. But first, let me read her short bio. She's a medical doctor. She's a psychiatrist. She's been a lifelong spiritual seeker. And she's also been involved for nearly 10 years with IANDS, which is an organization devoted to near-death related experiences. She's worked extensively with developmentally disabled children and adults, both before and after training as a psychiatrist. She's been a guest on Grief to Growth, as I said in the past, where she spoke about her recent focus on inner child healing and self-love. And today, I think we're going to talk mainly about developmentally disabled children and her work with that. So with that, I want to welcome Dr. Rebecca Valla.
Thank you. Thanks a lot.
Yeah, it's good to have you back. We had a great conversation last time. We've talked a couple of times since then about our mutual interest in things like what the near-death experiences tells us about different things. And as you and I were talking, because we're both presenting to IANDS coming up this fall, and we'll talk about IANDS a little bit more, what that is, the International Association for Near-Death Studies. We were talking about that, and you brought this topic of pre-birth planning, which I'm really interested in. And especially as it relates to hardships like people who are developmentally disabled. So how did you come to being interested in that topic?
Well, I was interested in developmentally disabled since I was in high school. I volunteered with children in the town that I grew up in New Jersey, summers and during my senior, year of high school. And then ultimately, I worked the year after high school. I worked in a residential school for multi-handicapped children, and most of them were cerebral palsy involved children, which, is a very, many people don't really understand cerebral palsy. It's a brain damage generally acquired at the time of birth. Mm-hmm. And it can lead children to have little or no speech, not be able to walk, not to have use of their limbs, but it doesn't always impair cognition. So you can have very bright, very, functional in terms of their intelligence, young people, as it was, I was in a school, who are so involved in terms of their motor impairment that they can't feed themselves. And so I worked in that school for the better part of a year as a childcare worker right out of high school. And so what I was doing was bracing, bathing, toileting, dressing, and feeding children in that school. And then later, then I went on to college and I double majored in special ed and in social work. And I went back to that residential school as a teacher.
Wow.
And that was my first professional. Well, it wasn't my very first, but it was my main longest, post-college, job, which was very, very intensive. It was a school that was, residential. So, they were always there and they always needed for teachers to be there and teaching them. It was a very stretching experience. It was an opportunity for a lot of growth on my part. It was very difficult. I had to live at the school when I was a child care worker.
Oh, wow.
But anyway, that kind of got me started. And then I worked in a public classroom for children who had mostly autism at a young age. They were 4, 5, 6-year-olds. And then I went on to work in a vocational high school in Newark, New Jersey, just before I went to medical school.
Wow. Okay.
So I have pretty varied experience with that population. And then, of course, as a physician, I actually worked with adults who had developmental disabilities and psychiatric issues. And I helped them as a psychiatrist.
So that sounds like a really challenging, set of circumstances. And then you said you went to medical school, you became a psychiatrist, and you were also still working, I guess, with developmentally disabled people. And then how did you tie spirituality in with this situation?
Well, I mean, I don't know that I necessarily did early on. Other than, of course, what we know is that we're all one. We're all interconnected to one another. And so no matter how disabled a person is, no matter how different they may seem in terms of not being able to converse with them readily, or if they seem to have very limited cognitive ability to even kind of know what they understand, we can still make a connection with them on a human level, on a heart level. And I can't tell you how much fun it can be. And, that's hard, that's hard for most people to know, to understand how much fun it can be to be around disabled children. They tend to be very, very free in terms of their own emotions, and they can be very funny. They can be very socially sophisticated and engaging. And they're so full of life and of love, and it's very heartwarming.
Yeah, I've heard people that have had developmentally disabled children, talk about what a blessing it is. And I think for a lot of us, we just look real quickly on the outside and we say that would just be so hard and it would be heartbreaking. And we look at all the negative aspects of it. But I've heard many people say it's like the best blessing they've ever had.
There's so much to be learned and so much to be gained. I have countless stories. So it wasn't until, my own spiritual development moved along far enough to understand about pre-birth planning and to have an understanding of why there could have been a choice on the part of an adult to have a child with a disability, on the part of the child to come into the world with a disability. And this is the kind of thing that, it takes some real spiritual depth and understanding to wrap yourself around that.
Yeah, it's one of those really, it's one of those really tough questions that we ask ourselves when we look around the world. We say, why would a child be born like this? And it actually reminds me of a story in the Bible where there was a man that was born blind, and they came to Jesus and they asked him the question, who sinned? Why was he born like this? He was born blind. And, we still, most of us don't have a good answer for this. Is it random luck? Did God, is it the punishment? Is it karma? Is it, is it a matter of sin? We say we go through all these different emotions, but with pre-birth planning, you're saying there might be a reason why someone would actually choose this. And that's going to be a mind-blowing concept to a lot of people.
Right. And I mean, it's not something to hit somebody over the head with when they just have a newborn baby,
right,
who has, been born with, some serious congenital abnormality, or defect of some kind related to their birth.
Mm-hmm.
It's not something to force on anyone.
Right.
It's kind of a truth that will be helpful if and when it is the right time for them to embrace it.
Yeah, exactly. It's one of those, I love the way you said it. It's one of those hard truths that we don't want to hit someone with, and we don't want to ever make anyone feel like, well, this is my fault. You're saying this is my fault, or you're saying I chose. It's something that we can offer to people as an alternative if it helps you.
Yeah. If they can come to it, and they probably will need time to come to it.
Yeah.
But a lot in the beginning. Unfortunately, this is an example of one of those things that the medical profession has not done very well with at all.
Mm-hmm.
And they tend to want, they want to bring babies into the world that are whole and healthy.
Mm-hmm.
And when that doesn't happen, they want to distance themselves from the whole, the whole truth of it, the whole actuality mm-hmm. of it.
Yeah.
And at least a lot of the parents that I knew when I was working with young disabled children, and of course this was in the 70s, so it was quite a while ago.
Mm-hmm.
Many of the parents had been told not to even bond with the children, to institutionalize them was the term.
Mm-hmm.
They'll never grow into like a functioning adult, and making all kinds of very frightening, negative kind of predictions.
Right.
And that's really not helpful. And that's not where the emphasis needs to be when someone is just beginning to understand
right.
that their child has disabilities and that they're going to need to have special care, and, they're not going to just sort of go along the normal course.
Right. And you said, I was just thinking normal's overrated, right? We have this idea of the way things should be.
Yeah.
But these children can grow into adults, and they can have very rich, fulfilling lives, even though they're not what we consider to be a quote normal life.
Right.
And some of their lifetimes might be shorter, but they could be full of rich experiences. And I'm thinking right now about a friend of mine whose son was born with lissencephaly. And he was only predicted to live, I think, till like 2, and he ended up living till like he was about 11. And she's told me it was a great experience for her family. I mean, it was challenging. She had 2 other children that was a real challenge, but just so much joy and love I could see that she got out of this child, even mm-hmm. though the doctors are like, don't bother bonding with him. He's never going to be able to speak. He's only going to live for a very short time. And I don't know if she was advised to institutionalize him or not, but, she kept him at home and had a great, great life.
Yes. I mean, any of us who've been parents, I think can understand the idea that our children are our teachers.
Mm-hmm.
We may not know that from day one, but they are. And as we learn and grow, with them, and we see them for who they are, they teach us so much. Mm-hmm. And that's one of the, benefits and gifts of being a parent, whether it's by biologically normal ways or whether it's adoption or something.
Yeah.
And disabled children, what they call now exceptional children, that's even more true. That's even more true, what they mm-hmm. have to teach us.
Mm-hmm.
It's a gift in its own way, but you don't want to trivialize the huge adjustment and the burden that is true. It is mm-hmm. there
mm-hmm.
With these children. It helps if you have other children who are not disabled.
Mm-hmm.
That helps everyone. That helps the children learn.
Yeah.
that helps the disabled child learn and bond, and everyone learns that, we're not all the same, and yet we love one another and we're family.
Right.
There's tremendous amount to be gained for a family having a child that's exceptional.
Well, let's talk about that. Let's talk about that from both perspectives. So let's first take the perspective of the disabled child. Why would someone choose to come into this world and not be an able-bodied person?
Stay with us. We'll be right back.
Hey there, something I want to tell you about today. My podcast platform, Buzzsprout, has recently made it easier for me to allow you to support me financially. Go to www.grieftogrowth.com/subscribe. That's grief2growth.com/subscribe. And once you're there, you can sign up to support me financially. Now, you can do it for as little as $3 a month, or of course, as much as you'd like. If you do that, you'll get access to bonus episodes, and you'll see those in the regular feed. They'll have a lock on them. But when you become a subscriber, you'll actually get access to your own private feed, and you'll be able to listen to the regular podcast along with the bonus podcast for the subscribers. I want to thank you for listening. I want to thank you for sharing the podcast. And I want to thank those of you who support me financially. Have a great day, and on to the episode.
Well, I think that it's pretty clear that they are bringing so much to whatever family they come into or whatever caregivers they come to. I mean, they bring everywhere they go. They're bringing tremendous gifts of learning and of greater understanding of what it is to be a human being. Because these are little human beings who love life, as limited as it is for them. They laugh, they love, they think life is so great. They're not, I mean, they may go through a time in their adolescence, depending on their cognitive awareness, where they wish that they were not disabled. But when they're young, they don't have an awareness of how different they are, and they're just who they are. And they're so free to be who they are, and to bring their enthusiasm for life and their desire to be here, even if they have to go through, like kids that I worked with in the residential program. They had to wear braces on their legs. They had to go through operations, many of them. Many of them have had multiple surgeries, and they were born with multiple medical issues. So they needed, brain, surgeries if they had hydrocephalus, and they needed cardiac surgery if they had some kind of major malformation. They may have had multiple surgeries. And then even as they grow, in terms of their motor, if they can't move their legs, they're at risk of contractures, their arms and their legs. And so then they need surgeries as they age for those reasons. And they tended to be so unfazed, really, by whatever life was throwing at them. They were just so glad to be here. So I think that, when we cross over, and this is something that we learn from near-death experiencers, we see clearly what was happening in this lifetime. We're on the other side of the veil, and we're shown. And so I think before a child chooses to come into the world, they are well aware of that it will be very hard and very challenging, but that it will be a very important gift that they give to show other people what it is to be human, to be connected to each other, to have compassion for one another, to say, there but for fortune go I.
Yeah. And so flipping it to the other side, why would someone agree to have a disabled child coming into this world?
Well, because there's so much to be gained. It's very common for parents in the very beginning to feel like they can't do it. They're very overwhelmed and afraid.
Yeah.
And they say, I can't do it. I don't know anything about, managing a child with this kind of disabilities. I'm not a nurse. And I've not had experience with children who have so many different needs. And so that's very common. And it's very important for them to begin just to, just take it easy. All you have to do in the beginning is love your child. That's all you have to do. And then it will unfold from there. There's nothing more important than that. So the parent is in a position to learn so much about themselves and about their own capacity. And they had no idea that they had it in them to be able, to parent this disabled child, and to be able to, to learn so much. Sometimes there's so much to learn if their medical problems are complicated.
Yeah.
And they also know very often if the disability is significant enough that the child will probably not live a normal lifespan. And so they know early on that they will probably lose that child before they might expect to lose a child that's, not disabled. And so that's another thing waiting for them. That's like, oh my goodness, how long do I have the child? And, and I need to make use of my time because it's possibly going to be shortened to be with this child.
Right.
And over time, they start to tell you, the adult parent starts to say, I can't tell you how much this child has taught me, how much I've learned, how much bigger of a person I am now. And they learn and they see things about what it is to be human that they would not have known and not have learned, and bond. And they learn, they meet other parents. And there's a lot of richness in that. And then a lot of the people who are in the field working with disabled children, whether they be in the education part of things or doing something more specialized, speech therapy, occupational therapy, physical therapy, they learn, oh my goodness, look at these people who are so dedicated to working with these children. And they get initiated right into a whole different world than they would have ever known if they hadn't had a disabled child. Yeah,
it is a whole different world. And as you're talking, I'm thinking about my friend that had the son with the listencephaly, and I would look at her and just incredible strength and the things that she, the wheelchair traveling with, and he had a GI tube for feeding, and then the pain medications and the seizures, and the knowledge that she gained, and the things that she found out she could do, and what a strong person that it made her. And since he's passed, she's now a city council person. She's advocating for the disabled. I mean, it's just, I think about her and I'm just like, wow, what an incredible person that she is, and partly because of this little kid that came in that really pushed the whole family.
Yeah, I know. And it's you have to admire the people who are living with all of that because it's a lot.
Yeah,
it's a lot. But they're also, most of them, they're not asking to be, praised or, lauded or given any kind of special recognition, because what they're doing is from the heart. They're following their heart. And this is about love.
Right.
It's love in action. I say, it's one thing to feel like you're a loving person. It's another thing to put your love into action.
Yeah.
And they're doing it, and they've been doing it every day of that child's life. So it's very admirable. And there's a lot to learn just from knowing these people who are parents of disabled children.
There is. And to me, it's kind of a microcosm of, the old question is, why is there evil in the world? Why is there lack? And, one of the things I say to people is we would never have an opportunity to practice compassion if no one ever lacked anything. So I think that gives us the opportunity to, as you said, put our love into action. And I want to say, I'll just interject this, this is not completely academic for me. My daughter was not disabled, but she was diagnosed with rheumatoid arthritis when she was like 10, and it was a pretty serious case. And I remember that feeling of like, okay, now I have to learn all this, right? And then I had to give her injections, and I had to give her, medications. and going to see the rheumatologist and the occupational therapist and those types of things. So just a little bit of tiny glimpse of that. But, I was happy to do that for my daughter. It's like you said, no one's looking for any medals or anything. This is what we do for our kids.
Yes. Yes. Right. And, and there are mysteries waiting for us. And that's true in life anyway, right? We don't know what will happen.
Right.
We think we know and we try to plan, but, life is filled with unknowns. And really being here is a gift. And I think that's one of the things that these disabled children teach us so much, is that it's a gift to be alive. And they want to stay, they fight to stay.
Yeah. Yeah, that's also a really important point, I think, because a lot of times, we tend to focus on what we don't have, or speaking for myself, I tend to focus on what I don't have. And you might not appreciate the fact that life is such a gift. And then you see, a kid that can't speak or can't walk or whatever, getting such joy out of, just being in a swimming pool, and seeing the joy in their face and just appreciating the what we call the small things in life.
That's right. That's right. And don't think that just because a child is, considered, profoundly disabled, that they cannot love their family, because they can.
Yeah.
They can.
Yeah. Because you mentioned working with autistic children, and I don't remember the details, but there was a girl who was autistic, and somehow she learned to communicate through a computer. And when she was able to do that, they realized she had these profound thoughts. It was like she just opened up, and they, sometimes we'll look at people that are autistic and say, well, they're just living in their own world and they don't have any idea what's going on. And when she was able to make that connection, it was just really amazing to find out what was going on inside of her.
Right. Well, when I was working with the teenagers, when I was a teacher and I went back to this special school, I worked with teenagers at that point. Mm-hmm. And so they were needing to learn to communicate with computers, and it was just beginning. It was, it was like around 1979 or so. Mm-hmm. And it was all really, the technology was just beginning. I think it's advanced a lot since then. But so has the whole understanding of autism. Because
right.
When I was working with the autistic children, which would have been like in 72, 73, maybe something like that, very little was known about how to help them, how to teach them. Even diagnosis was very slow in coming. And now we understand this whole idea of what it is to be neuroatypical versus neurotypical, and the Asperger's syndrome, and how unique and individual each of these children is. And yes, some are savants. I mean, they have unbelievable abilities that we can't explain. And there's a lot that is being done with communication of various kinds, sign language kinds of things, and as you mentioned, computers, and it's a whole burgeoning world now. The whole world of these autistic Asperger's children and adults, and there's people writing books about it, of their own experience being neuroatypical, and it's very promising in ways that we couldn't even envision when I was working with those little ones.
Yeah. Yeah, I tell you, sometimes I wonder, or not wonder, it seems to me like they're a lot more advanced than we are. They just this world's just kind of like, too much for them, because it's this, you have to be a little bit crazy to get along in the world that we live in.
It does show, right, some some ways of being in the world that just because we don't understand them doesn't mean there's not some real important meaning behind the behavior.
Yeah.
And how complex we are as human beings.
Yeah, exactly. And I like what you said also about, everybody being unique and having a different aspects. So we tend to, we want to diagnose people, we want to lump people and say, okay, well, they're like this and they're going to be, so therefore they're going to be like that. And then we find out, it's incredible, the range of human ability, and different abilities people have. Some people that, can't do one thing, but do another thing just like out of this world.
I know. Artistic ability. It's quite something. Creative ability.
Yeah.
Uh-huh. But, even children who are, profoundly, disabled and, they can't even sit up, that
Mm-hmm.
kind of thing. We may not be able to see, some kind of creative abilities on their part.
Right.
But the free and loving spirit comes through. That little person's spirit comes through. And, animals usually can bond very readily with them.
Yeah.
And they can with animals. There's so much to just learn, to just see it as, I'm going to take this in and I'm going to learn everything I can from what my life has dealt me.
Yeah, exactly. So I wanted to ask you, as a medical professional, because you mentioned earlier, medicine's not really great at dealing with situations like this. And so people, like I said, they want answers. They go to the doctors. Why did this happen? So they're going to give them some sort of a biological, mechanical, reason why this happened. And then people are going to, blame genetics or blame the fact that they smoked or, whatever. How easy or difficult is it for a medical professional to bring this type of approach when you're dealing with a parent that's going through this?
Well, I just think, it's the luck of the draw, right? People don't know when they're choosing an obstetrician, when they're going to have a baby.
Mm-hmm.
They don't know what's going to happen, and they don't know how this doctor's going to manage that situation.
Right.
There are some doctors who just instinctively are, able to
Mm-hmm.
manage when
Mm-hmm.
things are really going in an abnormal kind of a direction. But though they're probably in the minority. So what parents need to do is they need to get from a very early point, they need to be asking, who can I talk to who has some experience with, children who are born like my child,
Mm-hmm.
my child's kind of challenges, and they need to get to somebody pretty quickly who has experience.
Yeah.
And they need to use their intuition from day one, because so much of the parenting of these children is about navigating through all the medical resources and the world of rehab and therapy, specialized therapies, navigate and advocate for their child.
Right.
And, and a lot of that is an intuitive thing. I don't get a good feeling from this particular doctor or therapist. I don't like the way they interact with my child.
Mm-hmm.
They don't seem to have a real compassionate heart in the way that they interact with my child. I don't feel comfortable. I'm going to try to find somebody who has the skill that my child needs and also has the ability to receive my child in a way that is, showing compassion and, really respecting my child as an individual. And see, parents have to do that from the day one. They learn they have to be advocates.
Yeah.
In order to navigate all of the complexities that their child is going to need. So that's one of the benefits, is
Mm-hmm.
getting in touch with your own intuition.
Yeah.
About, what's good and right and what just doesn't seem right the way that it's going.
We'll get back to Grief to Growth in just a few seconds. Did you know that Brian is an author and a life coach? If you're grieving or know someone who is grieving, his book, Grief to Growth, is a best-selling, easy-to-read book that might help you or someone you know. People work with Brian as a life coach to break through barriers and live their best lives. You can find out more about Brian and what he offers at www.grieftogrowth.com, www.growth.com. If you'd like to support this podcast, visit www.patreon.com/grieftogrowth, www.patreon.com/GRIEF, GROWTH. to make a financial contribution. And now, back to Grief to Growth.
Stay with us. We'll be right back.
Hi there. I'm really excited to tell you about my latest ebook. It's 4 lessons that you can learn from the near-death experience without going through all the trouble of dying to learn them. I've been studying NDEs for several years now. I am completely convinced that not only are they 100% real, but that there's some very universal wisdom that we can get from the near-death experience. And I've distilled that down in this book into 4 short lessons. And I've also given you all the reasons why I believe that NDEs are absolutely real. So go to www.grieftogrowth.com/NDE lessons to pick it up for free. www.growth.com/NDE lessons. I hope you enjoy it. Yeah, and I guess that's one of the challenges, because especially in the medical profession, we're really quick to give up our power. We're really quick to say, okay, well, this guy is the expert, this woman is the expert, so whatever they say goes, and we're looking for that. And I totally agree with you, because I've seen so many people go against medical advice and say, no, I'm going to bring my child home, for example, or I'm going to do this or do that. And it turns out to be for the best. And so we have to understand that doctors are only human. And they might know a lot about the body, but they don't necessarily, not the best person to make decisions for our families.
Right. We really, and that's something we have to learn in the world now, as things are in our world now. One of the important things that I think everyone is being challenged with is what is true for them. Each one of us has to decide, what do I live for? What do I say yes to?
Right.
And what do I say, no, I'm not part of that. I'm not going to be, I'm going to take my power and I'm going to use it for, another purpose that I'm conscious and aware of. I'm not going to let somebody else, take over or, influence me in a way that doesn't feel right. And each one of us has to, we have to do that. That's what this world requires.
Yeah. I want to ask you, as a medical professional, in your training, are you encouraged, discouraged, or is it neutral in terms of bringing spirituality into your practice? Are you able to talk about spirituality? Are you able to introduce a concept like pre-birth planning or something like that?
Well, I do now because I've been at this for 30 plus years. But certainly no, was not part of, along the way, it wasn't part of my training originally. And I'm a straight trained psychiatrist.
Right.
I went to, American medical school and a well-regarded residency in psychiatry, but back then, I finished my medical training in 1990, my psychiatric training in 1990. There was just a hint of whether spirituality was even relevant to psychological health, for example. Yeah. But then, along the way, I worked as a medical director at a pastoral counseling center. And I was supervising these pastoral counselors. And of course, we were, all, advocating the importance of spirituality, no matter what a person's spiritual, foundation was, right? It didn't need to be Christianity. It could be Judaism or, Buddhism or whatever. But that spirituality was very helpful and relevant when someone is going through some type of a psychiatric crisis or just, life stresses and difficulties. And so I had more freedom there to just talk about the subject of spirituality and its importance. But then on my own, because of my own growth and leanings and my own sense of what's true and relevant, I just bring in spirituality. Now, not everybody is on board, right? And they don't all want to hear about near-death experiences or pre-birth planning, or they're just not on the same page.
Sure.
So obviously I have to respect that, and I can't go there with everybody.
Right.
But wherever they are in their spirituality, we can work with that. right? So if they're someone who prays, then yes, they can be praying for guidance and for help and comfort with whatever it is that they're struggling with.
Mm-hmm. Yeah, it's, as you're saying this, and I have to tell you, because I love that you do have spirituality in your practice. And every time I talk to someone that says, I need a psychiatrist, I'm going to say, go see Rebecca, because you're the only one that I know that's like that. But I went through a crisis myself when I was about 40 years old, so about 20 years ago. Panic attacks, terrible, it's just out of control. And I realized, fortunately, that it was connected to my faith. So when I went to see someone, I specifically saw a Christian counselor. And I'm glad that I did, because if I hadn't, I'd probably still be in counseling. But we were able to get right to the root of what it was. And I was with her about 6 months, and then I was okay. But it's fascinating that psychiatrists, because I think we're spiritual beings, and psychiatry, which is studying the mind, kind of blocks that out. And I think it'd be a lot more effective if more people were like you.
Oh, well, thanks. But, I wouldn't be practicing the way I do if I hadn't had a lot of psychotherapy help along the way, and even now I work with an energy healer who, she helps me in terms of, the continuing inner child healing, self-love work, expanded consciousness and wholeness that, I'm all about. So mostly what I have to offer my patients comes from what I've learned myself in my own life.
Right. Yeah. I'm just kind of wishful thinking here that we could become more holistic in our approach. Because I was talking with a client just yesterday who probably needs professional, counseling, mental health counseling, but they like talking to someone like me because I'm talking about their whole self and the higher perspective and the soul stuff. And she's like, I wish I could get somebody that could do, both of these things at the same time. So that's where I think we kind of fall down as a society.
Right. Well, luckily, there's a lot being done with spirituality now. Not necessarily with MDs and psychiatrists. I would say that the field of psychiatry seems to be moving, because things can be happening kind of out of the mainstream that are going to make a big difference in what will happen down the road. But what seems to be happening right now is the brain is, the psychiatrists are dealing more and more with drugs and with the brain and with the idea of material science, materialist science.
Right.
And that just takes us away from the fullness of what it is to be a human being.
Yeah, I think I mentioned this to you last time that we spoke. There's a book by a guy named Johann Hari. It's called Lost Connections. And it's about why we are so depressed as a society. And he looks at antidepressants and how well or not how well they work. And they're not nearly as effective as some people think. They're very effective for some people for periods of time. But I believe the mind spirit connection is kind of a feedback loop. And I think the brain chemistry can affect our spirit, and our spirit can affect our brain chemistry. And we only look at it this mechanistic point of view. It's like, oh, you're depressed, take this pill, you'll feel better. As opposed to looking at why are so many people depressed. And his book is called Lost Connections. And basically the theory is, or the hypothesis, that we're not connected to each other anymore. And that's why so many people are depressed.
Yeah. Well, and just think about it from the doctor's perspective. If they're just giving somebody a prescription, they don't have to get to know that person. They don't really have to spend a lot of time connecting to that person and having great compassion for whatever that person has endured in their life. And it's easier for most doctors because they're not going at their work. And that has to do with training as well as, expectations and cultural influences and all of that. We're not really seeing each of the people who comes into our office as fully as possible.
Right. And that reminds me, because I think this is true. Hopefully you'll correct me if I'm wrong, but this guy was talking about, I guess in the DSM at one time, there's a definition of depression, And they actually carved out an exception for grief because they realized if someone dies, then you're going to be sad. And so that's not clinical depression, I guess. But I guess that happened for a while. And then they came back and said, well, no, because now we're admitting that depression is caused by outside circumstances. And I think they took that exception out. So you could still be diagnosed as depressed if you're just in grief. And I bring this up because I was seeing a doctor. This was, I don't know, a year and a half, 2 years after Shane had passed. He said, how are you feeling? I said, well, I'm stressed. I'm depressed. And he goes, well, what's going on? I said, my daughter passed away 2 years ago. And he goes, well, that's normal. And he said, do you feel like you need anything? I said, no, I'm fine. And so he said, okay, great. Because I'm like, this is what I'm going to feel when someone passes away. Now, I saw another young lady. She was a very young doctor. She was she looked like she was just out of medical school. And I told her the same thing. It was a little bit while later. She said, oh, we need to get you on medication. And I'm old enough now to say, no, I don't want or need medication for what I'm going through. This is a normal part of being human. So I think the medical profession needs to, I think, kind of back to what I was saying before, view people as whole people and say, why do you feel depressed? Is this a normal thing? Are you functioning okay? And, are you, that kind of stuff.
Right. Well, but that means doctors have to be whole people, right? Which just creates all kinds of issues because we selectively choose people for medical school who are very left-brained. And they're very focused on memorizing and on, whatever they can say from a knowledge viewpoint. And we don't go a lot into, people don't have to have psychotherapy before they go to medical school. People don't have to have some kind of psychological work on their own past before they become doctors. That's just bypassed.
Yeah.
And as I say, what happened with me was that I went to psychotherapy for 5 years before I ever went to medical school. And so it was sort of a no-brainer that I would go into psychiatry.
Yeah.
And then I gravitated sort of certain kind of work that was part of what I knew and what I felt most confident about. And of course, it led me to do more and more, spiritual work with people. And of course, not everybody who comes to me has really any interest in spiritual growth.
Sure.
So I have a wide range of people. But, we can finger point at doctors, but, we just have a problem with our culture. We have a problem in, wider context.
Right. Yeah.
We live in a capitalist society and people are treated as commodities.
Yeah. And I don't mean to finger point at doctors because you're right. It is a societal thing. And you made a good point I hadn't thought about before, because I was thinking it's training, but it's also selection. We select people who are like that can memorize a whole lot of facts and regurgitate them, and not necessarily people who are compassionate or spiritual or even understand what psychotherapy is, or frankly, even care what psychotherapy is.
Yeah.
Because they view us as biological robots. And even the brain, it's like, okay, you're depressed, take this pill. You're anxious, take this pill. And it'll just switch that little thing off and you'll be fine.
I want to tell you all about another doctor you may not know about. Her name is Karen Wyatt.
Oh, yeah.
Her last name is Wyatt.
Yeah, she's
and
awesome.
Karen is an example of somebody who went to medical school thinking that she was going to be able to put love in action. That's how she was thinking about it. I'm going to be a doctor and I'm going to put love in action. And I'm going to be basically, with my heart, I'm going to be coming toward each patient and I'm going to be able to embrace and help them with whatever their needs are, whatever their pain is. And she found out very quickly in medical school, nobody wanted to talk about love. And certainly they wouldn't want to talk about loving your patients.
Yeah.
And they basically didn't allow it. It was just, she understood that, this is like a revolutionary idea here. And she had to be careful, although she did find in her training that some doctors who were more advanced in, supervising her work would ask her to go speak to certain patients who were afraid or were being resistant because of their fear, and like talk to them and see if you can, help them understand why we have to do this surgery or whatever. And so they did recognize that the way she approached patients was beneficial, but they didn't allow it in terms of they didn't want to have to change and they didn't want to have to become loving doctors. Oh, that's not going to be comfortable. So she ended up over time going into palliative care. And now that's what she does. She works with dying people. And what she found is that when people are dying, everybody's happy with me being all about love, and we can all be about love as a team of nurses. And we can be about loving this person out of this world and helping their family emphasize love as they say goodbye. And that's what's most important, to remember the love, to repair where there's been brokenness in connection with family and others. And so that's what she does, and she fits in very well. And now she's writing a number of books on the subject of death and dying, and and helping people, to the other side. So she's, I'm not the only one. There are wonderful doctors, who are, and Bernie Siegel, of course, people know his book Love, Medicine, and Miracles, and we're learning about ways of being healers as doctors that don't involve the body particularly. They involve consciousness, prayer, intention.
Yeah.
Not manipulation of the body, right?
Yeah, there are those people out there, and I've interviewed Karen. I've actually talked to her a couple of times. She's a fantastic person, and so those people are out there. They're kind of bucking against the system. Yeah, and it'd be nice to maybe one day see us again, kind of treat people as whole beings. Yeah, have more of us doing that. And it was interesting. I was talking about that those two doctors' experiences I had, pretty close together. One was very young, like I said, pretty much just out of medical school. The other was an old guy. He's probably about my age, and I guess he'd been around for a while and realized, people are, they're more than just their bodies. And he really he took the time to talk to me to find out what I was feeling and how I was doing. And I told him I was okay, and I was fine with what I was. And he said, okay. But the young woman was just like, in and out, and if I keep hearing this from you, then I'm going to have to put you on medication. I'm like, well, you're never going to see me again, so that won't be a problem. So because I did not go back to her.
Right. Well, you listen to yourself, right? Your instincts. I wish people would do that more often, and buck the system, if you will, and say, I'm not feeling it to be here with this person. This does not speak to what I need. Yeah,
exactly. So I want to talk to you because I know you're really involved in IANDS, and I'm really fascinated with your topic for the upcoming IANDS conference in September on what the ego is and how we should interact with our egos. So tell me a little bit about that.
Well, I'm going to be talking with David McGinley, who's a fascinating guy. He's a chaplain, and he works up in Nova Scotia, and he works at a cancer hospital. And he himself has had cancer numerous times. I think 4 times he's had this cancer recurrence, and he's also had a near-death experience during one of those times. Wow. So he's fascinating, and he's written a great book called Beyond Survival, which is really great if you're talking to people who have a family member with cancer or who themselves have something that they think might be terminal, and they want to face the scary proposition that they might not live much longer. It's a wonderful book. So we're going to be talking. When he had a near-death experience, he came back from that, and he uses this phrase called the ego is my homework. So, near-death experiencers tend to talk about home being the other side of where they went, and they felt they were at home. This was their home. And most times, they don't want to come back because of how wonderful it feels and how loved they feel. And often they don't have a choice. They're told that their time isn't yet and they need to go back. Sometimes they have a choice. So when they come back, they don't call this place home. They know that home is the other side, right? But they understand that they have come back because they have work to do. And the work is growth work, so it's very interesting what you call your podcast, right? Grief to Growth, that they have growth work, spiritual growth work, if you want to really focus on that. And yet it's going to take work because they have to integrate it into their life here on earth. And for a lot of the near-death experiencers, that feels impossible. They just like living in my body and living, as a spirit on the other side. There's no way I can't do that. I can't do it in the body on earth. I don't know how to do that. And so, of course, they don't know how, because it's going to take work. It's not going to happen immediately. It's not going to just happen. They have to find a way, and they have to process what they've learned, and they have to put it in the context of being a human being. We're spiritual beings in a body on earth, and that's a certain context.
Right.
And so it's going to take some translation and some time and some real effort. And part of that effort is the ego, right? Because our ego is our sort of our persona, right? It fits into the world that we know here on earth, to kind of live out of your ego. And and our ego is not our best self. Our ego is sort of a immature version of our best self. And our ego is not the most spiritually informed part of us. Our ego is not the most committed to the highest of human values. And we see that, all around us. People tend to be very self-interested. They want what they want. They will hurt others to get what they want, or ignore others, or displace others to get what they want or what they think they need, and make a lot of excuses for why our best selves, our most compassionate selves, our most empathic selves are not the way we lead our heart-based self. And we instead leading from ego is not our best self, right? It's self-interest. And I've given a talk for IANDS about self-love versus selfishness, because people get all confused about the difference.
Right.
And ego is, largely kind of caught up in selfishness. And it's, it's a part of us. It's not that we can somehow, just completely remove ourselves from our egos. Our egos are a part of ourselves. But we need to make a commitment and make a choice that our higher self is going to be the one that's in charge, not our ego self. And it takes a while to be able to, to get there, and to work with our ego. And there are other ways of thinking of it. You can think of your ego as your child self, or your immature self, or automatic self, that, things that you might want to do or think about doing. And then you say, wait a minute, that wouldn't be very kind. That wouldn't be who I really want to be in the world. And, sort of, take charge of yourself. But, so there's realities about the ego. There's, realities about what it is to be in a human form here on earth. But there's homework to do, right? So that's what we're going to be talking about.
Yeah, I think that's awesome. The thing is that I believe that this world is a place we come to learn, to grow, to challenge ourselves, whether that's for whatever reason that is. And so the ego, because it's very, I think it's kind of complicated for me anyway, because we need our egos so we can take care of ourselves also. Because if we literally had no ego, we wouldn't take care of ourselves. But the ego can't be in charge. So being human is difficult. It's tough. We're this spiritual being, but we're living in a very limited world, apparently limited anyway. It appears to be. It is from our perspective. And so it's a challenge. And I like what you said about the end of the years, talk about us being here to grow. And that relates back to our first, what we first leaped off with is, why would I have these challenges, and these challenges that we can look at hopefully we get to a point where we can look at them as opportunities for growth, where we can, instead of saying, why did this terrible, terrible thing happen to me? God must hate me, or I have the worst luck. We can start looking at it and saying, what can I learn from this? How can this make me a better person? How can I take this, whether you believe spiritually or not, just what's the opportunity for this?
Exactly. And if you are a spiritual person, then you can turn to your spirituality right away, immediately, as soon as you have this daunting, prospect of, oh, I have a child with a disability. Go to your spirituality and ask right away. Mm-hmm. Ask to be helped, ask to be guided, ask to be comforted, ask to, find the strength. And you will be.
Yeah.
Ask and it is given, seek and ye shall find.
Yeah.
That is really an experience of what it is to be a spiritual being in a human body.
Yeah. Yeah, exactly. I think that's a fantastic point too, because we do often feel alone, and so again, something like what you're talking about here, that understanding. I was talking to someone the other day, and they called it the small self versus the big self, or we could call it the ego versus the higher self, or whatever you want to call that other aspect of ourselves that is a little bit beyond. That's beyond what our ego is, and so many of us, we're so caught up in our heads and our thoughts that we totally identify with the ego. And we think, that's it. This is me. And it's not you.
Yes, that's right. And we have different parts of ourselves. And there's different ways to talk about it.
Mm-hmm.
These different parts of ourselves. And there's a book that's coming out by a psychologist named Richard Schwartz, who he founded something called internal family systems. And it's an understanding of how to work with people in psychotherapy. And his new book is called No Bad Parts. And to try to help us to understand how we have different parts of ourselves. Yeah. And we have to find ways to, really, self-awareness is a huge, huge part of what it is to be alive. It takes years.
Yeah.
And it's not easy.
Right.
Really, to become self-aware.
Yeah, I like that. I like that no bad parts, because I don't view any part of myself, even my ego, as an enemy. It's there to serve me, and I need to live from my higher self and let the ego serve that. But it's not like I'm not in a war with my ego. Mm-hmm. That's just the way that I choose to look at it. And you're right. The self-awareness thing. I've been working on it for a while, and I feel like I was talking with someone just the other day, and I think he's a little older than I am. I just turned 60, and he goes, I don't really have, we were talking about the Bible and questions and stuff like that. And I'm like, I'm so fascinated by it. And he says, I'm over all that. I don't really have those questions anymore. I said, I hope I never get to that point. There is so much to discover about myself and about the world around me. And I feel like I'm just getting to know myself, even at this point.
Yeah. And that's part of self-love, right? To really appreciate how much there is in being a human being.
Mm-hmm.
And how, we change and we grow, we learn, we expand. And, if we really are engaged with our lives, it keeps going. It pays our way forward.
Yeah.
So that we don't stop growing until we stop breathing.
Yeah, absolutely. And even then, it's because there's this, and I was going to mention this earlier when we're talking about the medical profession, they're taught, and we're taught to view death as the enemy. Death is the ultimate failure. And as a doctor, you have a patient that dies, you failed. But the fact is 100% of us die, 100%. So to view that as a failure just sets you up for everything's going to end in failure. I view it as I know you do, as a transition into the next thing. So I want to get done what I can get done while I'm here. But once I leave here, it continues. Things go on.
That's right. And my understanding is on the other side, we have opportunity to continue to learn and grow. Mm-hmm. It's not just here. And so that goes on there too. I guess we have some advantages to being here. That's my understanding. that we have some advantages to do the growing here on Earth. That, it's maybe, I don't know, it's more, there's some kind of evolutionary thrust that happens with being human beings. So
yeah, I've heard it put as there's so much resistance here that we can grow faster. It's kind of like, it's like when you lift weights, if you lift heavier weights, you're going to grow faster. And I had a friend who was relating this stuff, and he was saying that, and if you're a Pleiadian, for example, you can learn as much in 10 minutes on Earth as you can 10,000 years being a Pleiadian. Because of the resistance that we have here. So that's the reason why we choose to come here and have this. But there is continued growth, on the other side. I was talking with someone about the other day. They asked, is there a final destination that we all go to? Like we were taught, in Sunday school, it's like Earth and then heaven or hell. And we go to heaven and that's it. It's perfect. We never go anywhere else. My understanding from studying NDEs and everything is we go from here to the next level, to the next level, to the next level. And I heard someone describe it as like, if this is a dream, it's like you wake up from this dream and you wake up in another dream. That's a little bit higher level than this, but then, it's a while before we go back to that ultimate thing, if we ever do.
Yeah. I mean, I've got enough on my plate to figure out what to do with my time here. Right?
Yeah, exactly.
So I don't spend a whole lot of time thinking about what's going to happen when I'm beyond this Earth.
Yeah, I know people get really caught up in that. How many levels are there? And I'm like, I'm the same way as you. I'm like, let's just figure this one out for now. And I'm just gonna accept the next one's gonna be better. And I'm gonna leave it at that.
Well, it will be better in the sense that we'll be united with our loved ones, right?
Yeah.
The ones that we miss and that we long for. So we know that's waiting for us.
Yeah, absolutely.
That's wonderful.
Or Dr. Valla, it's been really fascinating again speaking with you. I really appreciate what you do. I appreciate your work with IANDS. I love your holistic, well-rounded view of human beings. I wish every medical professional could be like you, and I hope we'll get there one day. But
wow.
Any last thoughts before we wrap up today?
Well, I just would encourage people that no matter where you are, you are where you need to be. You just get started from wherever you are. And it doesn't mean, if you feel like, oh, I've blown it, I've made some bad choices, I have a bad attitude, I can't like put my life together in some positive way. Yes, you can. It's not going to happen overnight, but you can start from wherever you are. Doesn't mean you can do it by yourself either. You might have to reach out for some help.
Yeah. I think that's really, really important and really profound because people have so many regrets about the past, but every day is a new beginning. Every day you can start over. You can start over in this moment and just dedicate yourself to improving yourself going forward. Where can people reach you if they want to find out more about you?
Well, my website is RebeccaSVallaMD.com. And I don't, people ask, do you do like virtual sessions and things so that, they can reach me if they live out of my area. I really am not set up for that. I have a full-time practice in my office. Right. But I will try to talk to people if they want some guidance or, if they want, I will try to point them in the right direction and, that sort of thing.
Yeah.
A lot of different books. There are books on my website that they can look at.
Okay. Some resources on your website, and everybody can find you at IANDS this fall.
That's right. Please come to our virtual conference this fall. It's over Labor Day weekend.
Yeah. I'll put a link to that in the show notes. Well,
thanks so much.
Again, it's really great seeing you again. Enjoy the rest of your day.
Thanks so much, Brian. Thank you. Bye-bye.
Thanks for listening to Grief to Growth. Brian hopes that you find this episode helpful and will come back for future episodes. Brian's best-selling book, Grief to Growth, Planted Not Buried, is a great resource for anyone who is coping with grief or knows someone who is. If you enjoy the podcast and would like to support it, there are 3 things you can do to help. The first is to share the podcast with someone that you think it will help. The second is to go to iTunes, rate, and review the episode. The third way you can support the podcast is by becoming a patron. Head over to www.patreon.com/grief2growth. That's patreon.com/grief the number 2, growth, and sign up to make a small monthly donation. Patrons get access to exclusive bonus content and knowledge that you are helping to spread the message of grief to growth. For more about Brian and Grief to Growth, visit www.grieftogrowth.com.
Hi there. I hope you enjoyed this latest episode of the podcast, and I'd love to hear your thoughts. What questions came up for you? What did you like about it? What didn't you like about it? I invite you to visit us at grieftogrowth.circle.so. That's grief, the number 2, growth.circle.so to continue the conversation with me and with other listeners. It's a space to sound off, to share reactions, and to go deeper into the topics from the show. I look forward to chatting more, and I hope to see you there.